everything to make this safe and efficient. So,
Well,
support. Yeah.
are you a freshman at the university?
No, no.
I'm teasing. You look like a
No.
freshman.
Well, thank you.
Well, no, thank you for what you're doing. It really matters. As I said to Doc a few moments ago, Dr. Chris, we committed when we got in that we were short on vaccines and short on organization, and when we got sworn in, and we committed to do 100 million vaccinations in the first 100 days, and we're exceeding that. With the grace of God, the goodwill of neighbors, and help of people like you, we're going to end up doing more than that. So thank you for what you're doing. You're saving people's lives.
Absolutely, and I'm more than happy to be here.
I'm going to turn it over to the Vice President. She's got the tough questions.
Hi, Brittany.
Oh, okay. Hi.
Hi. Thank you for everything you're doing. You are a role model of how this kind of approach can work. And thank you for that, because it's not easy being a role model and being one of the first. But that being said, you're a leader really in the country around what you're experiencing right now and how that can help others that start to pop up. And we intend on doing this around in many places around the country. So what would your advice be to others who are setting up an operation like yours? What did you learn worked and what didn't work, so we can learn from whatever you have experienced?
I think, like I said, one of my biggest challenges was staffing and just how to incorporate. I feel like I had incorporated things that I had worked, as a bedside nurse, getting a huddle together, getting a process together. I have made a actual charge binder, is what I've been calling it, that has everything my charge nurse would need to know to be able to run the site efficiently. And then I'm always available for questions and support. I think that's the biggest thing, is to let them know they're not alone in making decisions, and being able to keep our patrons and staff safe.
That's great. Thank you so very much. You're doing it, and you're making a huge difference, and you are inspiring all of us. So thank you for everything you are doing. It really does matter in such a big way. Thank you.
Thank you.
Are you a nurse?
I am. I'm a nurse. I'm an RN. I've been an RN for about 9 years now.
Well, I know, having been a significant consumer of health care, I can tell, I know the Vice President knows this when I say it, doctors let you live. Nurses make you want to live. If there's any angels in heaven, they're all nurses, male and female. And that's not an exaggeration.
That's right.
That's the God's truth. Thank you for all you do.
Thank you very much.
Thank you. Okay,
All right,
keep it going.
I'm going to turn it back to Dr. Chris.
Okay.
Thank you so much, Brittany. She is one of our most dedicated nurses out here, but we have such a great team. Behind us, you can see, this is the site behind us. Takes about 30 minutes to go from the time you pull on to the time you leave. But with me, I have our acting regional administrator for FEMA, Tammy Luttrell, and the head of the Arizona National Guard, Major General Michael McGuire. So I'm going to turn it over to Tammy.
Good afternoon, Mr. President and Madam Vice President. It is such an honor today to be a part of this state's initiative to stand up what I call one of the most efficient and effective vaccination centers, to just be able to see all levels of government and the private sector, as well as all the volunteers, come together to help the American people get vaccinated, is going to help us as a FEMA team be able to go back to California and be able to set up our vaccination centers in Oakland and in Los Angeles next week. The one thing that I would add to the number of FEMA employees that we have deployed across the nation, we have now a total of 991 FEMA employees deployed to help with these efforts. The one thing that we're doing is working very closely with CDC and our public health professionals on how can we reach those in underserved communities. So what we're going to take back when we operate and we open those two sites in Oakland and Los Angeles is we are going to provide mobile teams. And these mobile teams are going to be able to reach those who are not able to drive or get to a vaccination center. We also just want to emphasize that FEMA is providing 100% reimbursable financial support to our states, to our tribes, to our territories, and it's really important. We're also providing food support, also meals on, similar to like what we normally know as Meals on Wheels, but to be able to get food to those who are not also able to get out. Of course, we cannot do this big lift of standing up by scratch. As you can see, we're showing you today an efficient and effective operation. In order for us to replicate this and to be able to open timely so that we can reach your 100-day goal, we are partnering with the Department of Defense, also the United States Department of Agriculture and Health and Human Services to be able for us to replicate what we see and what we have learned here today. With that, sir, I believe I'd like to just take a moment just to share two examples that we have heard of, and that is the Navajo Nation. Yep. So as we support the Navajo Nation, we are going to stand up 4 vaccination centers. This will help increase their access to the vaccination, as well as take the burden off of their tribal members from having to drive in these austere winter conditions that they are experiencing right now. And then we also have our FEMA Corps teams who are helping us in the state of Kentucky. And they are also very mobile, and they are helping those seniors and those 65 or plus to be able to register and to be able to help them also enroll or do whatever it takes to be able to get vaccinated. We also want to help open schools safely. So bottom line, we want to help those at risk, and we want to get back to where people can move around, get around, and be educated as well. With that, I just want to close with expressing my deep appreciation for those of you working here at this stadium, the State Farm Stadium, all of you. I had an opportunity to come to both the day shift and the night shift. Just can't thank you enough. The positive attitudes of those performing jobs that they traditionally don't do. But it's all about the willingness, the attitude, and the heart condition that we have all come together in order to make this happen. So with that, I also want to just close with thanking you, Mr. President and Madam Vice President, for your leadership and leading the way.
Well, thank you.
I will now turn it back over to you, Mr. President.
Well, first of all, thank you. You're doing one heck of a job. One of the things that when we started to try to figure out what we were going to do when we came into office, because there wasn't much of a transition. We didn't have, we weren't given a lot of information. And some of the information we had turned out not to be accurate in terms of vaccine supplies. And we met virtually with all the governors. And the governors basically said, just send us the vaccine, we'll take care of it. And the fact is, I think they and everyone else vastly underestimated the logistical needs that go with having the vaccine, assuming you have enough vaccine. And so one of the first things we did was called in FEMA, and also contacted every governor general and told them that we'll pay for the National Guard. It won't be their expense because you guys are and women are badly needed. And in addition to that, the Defense Department has allocated over 1,000. They're going to go up to 100,000 people who are going to be helping along, 10,000 people who are helping along the way. So I just want to thank you for the coordination. I mentioned this to Dr. Crystal earlier, but the coordination is really, really matters. And we've got people who know what they're doing, starting with the doc and you two both with FEMA and well as the National Guard. That's your business. You know how to get it done. And so and you are really doing it. I just think what you put together is amazing. Our hope is that we're going to be able to not only keep the commitment to get 100 million shots in people's arms by the first 100 days. I think we'll exceed that considerably, but also we've now been able to go out and talk personally with the vaccine manufacturers. They've upped significantly the commitments to the amount of vaccine they'll produce and when it will be produced. And so things are beginning to click. People are beginning to feel that they can find their way to get the vaccine. And lastly, one of the most important things for us, and you mentioned what's happening on the Navajo tribe, I've met with the leaders, is that it really does matter that we have access to the people who are most in need and most affected by the COVID crisis, dying at faster rates, getting sick at faster rates, but not being available, not being able to get into the mix. And so equity is a big thing, and I want to thank you all three of you for engaging in that. But we're going to hear from, I'm going to turn this over to the Vice President, but General, I hope we're going to hear from you as well after the Vice President says something to whatever she wants to say, okay?
Thank you, Mr. President. Just a quick question. Ms. Luttrell, can you talk a little bit about what you think will be the challenges in terms of the mobile units and what will be the strengths of that? Because again, we're going to be watching these first rollouts as a model for what we do in other places. So from the ground, what do you see as being the challenges and the strengths of that operation around mobile units?
Sure. I would start with the strengths only because I've talked to our CDC partners and the public health professionals, where at first I thought we were going to have, be using or depending upon our mobile command vehicles out of our detachment, our MERS detachment out of FEMA, which they are still going to assist and help us because they have the means to technology where we could take on the road and then also be able to allow those who need to enroll be able to do so at ease. But after talking with CDC and the public health professionals, they educated us and let us know that there are mobile operations within the public health sector that are really good at mobile operations. So we're going to maximize as much as we possibly can and not just lean on our own understanding or our own FEMA resources in order to go mobile. So a lot to learn still, but we're staying optimistic that we're going to once again be able to come together and be able to reach those who need us the most.
Thank you. Thank you.
Thank you, ma'am.
General, how you doing?
I'm doing good, Mr. President. How are you today?
Better for seeing you, man.
Well, we appreciate the partnership with FEMA and all the DOD, all our federal partners that have been out here, IHS, HHS, all the things that have happened. In Arizona, as you know, we have 15 counties and 22 tribes that have sovereign lands inside the borders of Arizona. And those 37 entities work collaboratively with our agency. And I have the unique and distinct privilege of not only commanding the Arizona National Guard, but functioning most analogous to Mr. Robert Fenton, your acting FEMA administrator here, at 17 other states and territories doing emergency management. Couldn't be prouder of the partnership we have, not only with our federal partners, but obviously our local county hospitals, the incident command teams, and then the guidance that we get from Dr. Christ and her team working together. And when we were brought into this problem set once the vaccine rolled out, from a military perspective, we just felt that we had to increase volume. And so the governor's office and Dr. Christ proposed a partnership here at State Farm Stadium. We put a team of planners together with all of health services and brought in a whole lot of volunteers. And as you can see, over half of this is now staffed by volunteers. We feed them while they're here. We provide them a work rest cycle. But literally the idea is to get this functioning with as little help from the Guard as possible so we can replicate this in all 15 counties all around the state. And we couldn't do it without the federal partnership, especially the financial resources and obviously the delivery of the vaccine. So thanks for all you're doing there on the federal team. And I look forward to continue to replicate this around Arizona and hope plagiarism is the highest form of flattery. That's what we say. So if everyone wants to copy what Arizona's doing, we think we've got it figured out here. So thanks.
Well,
sir.
you sure have it figured out at that spot, General. And thank you for all you've done, and thank you for what you do. You've probably been deployed with your group several times in the last 10 years, so thank you for that as well. Madam Vice
Yes, sir.
President?
Thank you, General. Thank you very much for all, and please thank all your troops for us. Thank you.
Yes, ma'am.
And Dr. Chris, thank you for the tour and meeting some of the frontline workers. I'm sorry that we weren't in a position that the governor could be with us today, but he's been very, very cooperative, very helpful. He's stepped up, and this is the kind of partnership between the federal and state governments that I think in the private sector it helped us vaccinate more people more quickly and to get ahead of this virus instead of behind it. And we're optimistic that we have enough, we'll have enough of the vaccine in the pipeline to be able to provide shots for over, including double shots for over 300 million people before we get through the summer. At least that's our hope. And it includes getting vaccines at the pharmacy, as you pointed out to me earlier, Doc, and vaccination centers like the one you have there. And we're going to need, if we need more vaccinators, we'll send them. We'll find them for you. So let us know. And again, I want to thank you very, very much for your leadership and look forward to, I wish we were in a situation, it sounds, it's counterintuitive, because of COVID, we can't see you, come and see you, which we ordinarily be doing, getting on a plane and coming out and looking firsthand. But you know, the fact is that you're the reason why we're going to beat this, this disease, and we will beat it. You know, big or small, we're going to do whatever it takes to reach and surpass our goal of over 100 million in 100 days, and there's a lot to do, and it's going to take time. We're going to face some setbacks along the way, including the complication of the strains that we're seeing from South Africa and other places. But I know we can do it. We've never failed as a country when we've done things together. Never, ever, ever, ever fail when we're united. And you guys are the example of unity. So thank you, thank you, thank you. Madam Vice President?
Well, thank you all. As one of the first of this example of the partnership between the federal government, state, local, you all really are a model, and there are folks around the country who are going to benefit from the work you all are doing on the ground in Arizona. People who may not know your name, people you may not meet, but are going to be forever benefited because of your around-the-clock hard work. You are taking this on as a personal mission on behalf of folks who need your help, and you are there to do what's necessary. So thank you. Together with Governor Ducey, Senator Sinema, and Kelly, and so many others, I think we're showing how when we are unified, we can get a lot of good work done. So thank you all.
There's no such thing as a red state or a blue state when it comes to COVID. There's no such thing as Democrat or Republican when it comes to COVID. When we stand united, there's not a damn thing we've been unable to do, and you're the perfect example of that. So thanks again. Stay safe, and thank you.